everyone. We're going to take a look at continuing on with the Certified Medical Coding Specialist exam, looking at the anesthesia, integumentary, musculoskeletal, and respiratory systems. And this particular one for the CMCS, as long as you can look up the information, verify it in your book, or again, you can use an encoder, the answers will be based on you getting it correctly, will be, did you read all of your guidelines? Did you read your notes? Did you read your instructions? Can we use those codes together? Anesthesia, remember, we have certain codes that it will not let us use those together. So pay close attention to our do not report together. The first thing you want to look at anesthesia, again, these are going to be reported by the anesthesiologist. They're not reported by the doctor. They're reported by the anesthesiologist. We have our types. We have our start-stop time. So our types of anesthesia, we have general, we have peripheral blocks, we have spinal, epidural, local, our patient-controlled pain medicine. Then we have our start-stop time. The start begins when the anesthesiologist begins to prepare the patient for induction. So as soon as that anesthesiologist comes in there, gets the patient ready, begins to put it in, that's when the time begins. It ends when the anesthesiologist is no longer personal attendants. So when they're no longer there, when they turn that patient over to the recovery room, that's when it stops. So do not look at the start-stop time in accordance to the surgical procedure. You're going to have anesthesia starts, the surgical procedure will start, the surgical procedure will end, and then the anesthesia will end. It is reported in 15-minute increments. Medicare is the one that's a little different as far as how we report it. They want to get closer to the minutes exactly. So you're going to report that 53 minutes, 57 minutes. Otherwise, we're looking at 15-minute increments, and we can round it up with 8 minutes. So once we're 23 minutes, then we're looking at 2 units of anesthesia. When we have multiple procedures going on at the same time, you're not going to report the anesthesia code for each procedure. You're going to report the anesthesia code for the most comprehensive procedure that you have. The way you're going to know that is your base units are going to be more, the overall weight and billing is going to be a larger amount, reimbursement. What you will take into account is the base units that you have. So we want to, it's just one total time for both anesthesia. So if they do the dislocation of the hip and then they have a fractured of the foot, you would report the one with the most comprehensive score. Indexing. Indexing in our anesthesia chapter, when we go to the back in the index, we look at it, is divided first by the anatomical site, begins with our head and ends with our toes, and then by the specific type of procedure. So it may not always fall that way. You could possibly look just in the anesthesia chapter to determine the correct code. However, a lot of times the procedures are listed in the index, and it will send you to the correct code in the front, in the tabular. So what you'll want to do is you'll want to index to look that up. So for example, the surgeon performs a transurethral resection of the prostate, a TURP procedure. Remember, we're coding for the anesthesia, not the surgery. So again, you're going to look under anesthesia, not the surgery being performed. Look under prostate. Then you have 3 codes that are available: 00865, 00908, 00914. And then third, you're going to verify which is the correct code by verifying in the tabular. Our physical status modifier. What I noticed on the homework when I was going through it is that qualifying circumstances and physical status modifier was a little bit of confusion for you. The qualifying circumstance is an actual CPT code. It's an add-on code. It's those 99,000 codes that are listed in the beginning of the anesthesia in the green guideline pages. The physical status modifiers are attached to the anesthesia code. So they are an actual modifier. Your qualifying circumstances, they're used to indicate anesthesia services were provided under a difficult circumstances, and they're reported in addition to the anesthesia code. So we can assign as many of those that's appropriate for this particular surgery. On our types, so you have topical, that's where we're going to put it in. You have local, you have your metacarpal, metatarsal, and digital blocks. Our regional anesthesia is going to be your peripheral nerve blocks, your epidural, spinal anesthetic, monitored anesthesia care, our MAC, and then our general anesthetic. So here's a breakdown what you can use to determine what type of anesthesia it is, the responsiveness, the airway, the spontaneous ventilation, cardiovascular function. So as you can see, our minimal sedation, that's going to be your locals, your regionals. You're going to have normal response to verbal stimulus because you're not under. Your airway, your ventilation, and your cardiovascular is not going to be impacted. Your moderate sedation, you can have purposeful response to verbal or tactile stimulation. So they can either ask you to do something or they can touch to see if you can feel. There's no intervention required on your airway, and ventilation, you should be able to breathe normally. And our cardiovascular, we again normally do not have any kind of difficulties. Now they do watch those things and they do monitor them. Our deep sedation. So again, purposeful response following repeated painful stimulation. So they can go in while you are under and they can determine, do you have any feeling in the area by touching nerves. You may have to have an intubation as far as the intervention for our airway. Our spontaneous ventilation should be adequate, and cardiovascular function is usually maintained. General anesthetic is where we have the most difficulty. You can't arouse the patient. They do have to maintain their airway because they are under. Their body doesn't always continue to breathe on its own. Spontaneous ventilation, they will do that if it's inadequate. And then cardiovascular should be impaired. All right, here is an example of an anesthesia report. It is, and I do understand it's kind of blurry. If you're looking at it on a smaller screen, it's probably a little easier to view. What we'll see is the anesthesia report time. What I wanted to show you was we have the time, We have the IV, what it was, the type of anesthetic, the 150 milligrams, the ketamine, and the diazepam that they give. It was started at 2100 and it was continued on 2200, 23, and they drew the line all the way almost to 45. So 1145. So 2100 to 1145, there is 11 units. On our surgery, we're getting into, this is where we're going to start our integumentary. So this is the largest section of the CPT. You should probably have a question on your certification that is in regards to which is the largest section in the CPT. So again, it is in there. It's in your study guide. I believe it's in the front of your CPT book. But if you need to, make a note on the beginning that surgery is the largest section. We do have examples of format. So the example is you have general and integumentary are green, and they are our sections. You've got skin, subcutaneous, accessory structures are red, and there are subsections. And then introduction, removal are blue, and they describe the procedures that are being performed. So there are headings. So you want to remember your coding guidelines. They're very important. You're going to see these over and over. That's what's in the surgery guidelines. However, they do bring that to light in your study guide. So you'll want to make a note of these. Anything that has a tip, a coding tip, brings it like a hint, make sure to highlight that area, notate it, make a note in your CPT book, because there will be a question on your certification. That's the same with any certification. If the study guide says coding tip, remember this, that normally points to a potential certification test question. So laparoscopies, endoscopies are included in the main procedure. We're going to see these, and they're going to have separate procedure out there beside them. So remember, anything that says separate procedure, if it's done at the exact same time as the comprehensive procedure, we're not going to pick those up. Global surgeries and what's included. We've got our modifiers. So when do we need to add those? The semicolon, selecting the correct code, and our plus sign in other indications. So you're going to look at all of that information. Global surgeries, we break that down. We break down modifiers and such. So let's move on. Okay, our index. You're normally going to start under skin or the procedure performed, then skin. If it goes deeper into the muscle, then we know we go into the muscle because that's the deepest structure that we have. We have lesion removals. So with this, they do focus on lesion removals as far as this certification goes. What exactly is a lesion removal? How did they do it? A biopsy is where they're just going to simply take a sample of the tissue and a majority of that mass or area is going to remain. Paring is where they peel it or scrape it. The scraping, it's almost like a razor that they cut back, knife. Shaving, they use a scalpel, a razor blade to do thin slices at its base. Incision, they're going to cut it open. You want to make sure that an incision is just cut. There's not anything removed. Excision, the entire lesion is removed. So they will normally remove that entire lesion, and it can again be sent to pathology, but a biopsy would be included in that excision. destruction, we're going to use chemical to burn or laser that mass or lesion off. So it's broken down by our biopsy. So with our biopsy, you've got 3 techniques. Our tangential biopsy, which is a shave, a scoop, or a curette. So it's not an excision. It's going to be your punch biopsy, and it's going to use a punch tool to remove the full thickness sample. Incisional biopsy is your vertical incision or wedge penetrating deep to the dermis. 11,300 through 11,313. Shaving of the lesions, you're going to do the location and the size will determine that correct code. So we want to know where it's located. So for example, 11,300 through 11,303 is our trunk, arms, and legs. 11,305 through 308 is our scalp, neck, hands, and feet. Step 2, what is the size? And it's the total size of that lesion. You have 0.5 centimeters or less, 0.6 centimeters to 1 centimeter, all the way up to over 20. Sorry. And then we want to know how many they removed. So how many were removed? In our musculoskeletal system, you're looking at fractures, reconstruction, revisions, incisions, excisions, arthroscopy, spinal instrumentation. Again, for this certification, they are more interested, can you locate the correct code and assign based on the documentation you have in front of you, which is a small statement, and the guidelines and notes that are listed. So the tips that you need to keep in mind for our musculoskeletal is the fracture rules. They are at the beginning of the musculoskeletal. That's going to go over closed versus open. Remember that just because the fracture is closed, meaning there's no opening in the skin, they could actually repair it open. So you want to be aware in the code description, in the coding scenario that you have in front of you, does it say that they performed it open? Was there any percutaneous skeletal fixation devices? So when we index it, what you're going to start with, fractures, you're going to start with the anatomical site. And the rest of the musculoskeletal, you'll start with the procedure, then the anatomical location. Casting rules. With our casting rules, if the same doctor does every part of the fracture care, casting is going to be included. When you look at the CPT for casting, you'll want to make sure, are they in their scenario, are they listing that Dr. Smith placed the cast, but now the patient has presented to their primary care doctor and they're going to remove the cast. If that's the case, and they say the primary care doctor would report what, we're looking at the cast removal. Otherwise, the same doctor, if they place it, it's considered part of the global surgical days. Respiratory system. With our respiratory system, the tip that's listed in your coding study guide is surgical procedures includes diagnostic. So again, they performed a diagnostic whatever, endoscopy, bronchoscope, laryngoscopy, Those are going to be included in the therapeutic, the surgical procedure. So we're not going to report the tube placement or the scope that they're using to view things. We're actually only going to report what they performed. So if they did a biopsy, they did a mass, if they did a polypectomy, it's going to be coded to the procedure that was performed. Otherwise, if they just simply say they did an endoscopy, assign the correct code. Nasal hemorrhage on this right here, there is, I believe, two questions, and you do have a question in your study guide that it will actually, when you're going through and you're looking up your codes, it asks you questions about the packing placement. So pay attention to, was it anterior? Was it in both nostrils? So pay attention to that. Okay, 30,000 through 30,999 is nasal polyps. You want to highlight the conditions in your study guide. You can, for that, you can actually write them in your CPT code, because CPT book, under the CPT code that's listed there. That could help you later, not just on this certification, but for your AAPC. They do ask you questions as far as what procedure may be done for this condition, so forth. And you're going to have a multiple choice question. Well, based on that, you would have the answer written in your book, because you can use your book for any question that's on the test. 30,520 through 30,630, that's your rhinoplasty. That's to correct any kind of deviation that you have going on. So you want to pay attention to what the deviation is, what they are repairing. 30,901 through 906, that's your control, your hemorrhage for your epistaxis, your nosebleeds. So bilateral, you're going to use a modifier 50 on these. A lot of the other procedures are bilateral procedures, so you want to make sure that you know which ones need a modifier 50 to appropriately select the right answer for your certification exam. 31,231 through 31,298 are endoscopies. They're going to be selected based on the sinus that they are using the endoscopy for. 31,300 through 31,599, that's your larynx. It's either going to be indirect or direct, so pay close attention to that type. So again, when you are reading your coding scenarios, it's on the computer, it's not on paper. So you want to make sure that as you're reading, you pay close attention to all the details within the question. That's where you'll get off on selecting the wrong answer, is because you'll miss a tiny detail in a short statement. 31,603 and 31,605, these are emergency tracheostomies. It will specifically say emergency, so you'll want to pay attention to that. All right, so that's going to finish up this particular section of your study guide. It is broken down like this in your study guide, so go through it, review it, make sure you make any kind of notes that you need as you're studying in your CPT book. It will go a long ways during the certification exam for you.